Now, by no means am I a labor and delivery nurse, but I do know a thing or two. And I know that from the time a pregnant woman who is in active labor walks into the hospital, the clock is immediately ticking. There should be no hesitation with her situation. This lady needs to possibly be triaged if it's enough time, but things need to be set into motion for her to get that baby out safely, right? I recently watched a video of a nurse, LaChrista Vaughn, who works at Dallas Regional Hospital in Mesquite, Texas, sit and have her back turned literally to a patient who was in active labor. Like, she may have only looked at this lady one time, like just to turn around to look at her. She was asking her a bunch of questions, which at the time did not need to be asked. After she had already answered them once, she asked them again. She got on the phone. She completely dismissed this woman's pain, had no compassion, no empathy, and most of all, no sense of urgency for a woman who was in active labor. Not only did she put this woman in danger, but she also put the baby in danger as well. I watched this lady cry and scream and grunt and get on her knees in a wheelchair because she was in active labor. She made her sit in the waiting room for 30 minutes, and then the lady delivered 12 minutes after that, which tells you how detrimental the situation was. Like, this lady was fully clothed. I'm pretty sure the baby's head probably was peeking. Who knows what was going on? But her nurse acted very dismissively and had no kind of compassion for her or that child. That is a deadly scenario. That whole situation could have went totally left, all because this nurse did not properly do her job. She made this young lady wait in the waiting room for 30 minutes. 30 minutes. And then the baby was delivered 12 minutes after that. That just goes to show you how fast the labor was progressing. This young lady should have been triaged immediately because precipitous labor can go from 0 to delivery in almost no time. Especially when you've already had multiple children. If you've had multiple children, then you know that your deliveries most of the time go faster than the previous one, right? I've had multiple children, and that's how it was for me. This is what happens when healthcare workers forget that patients aren't just numbers or tasks, that they are actual human beings that are sometimes in the most vulnerable states of their lives. You can't teach compassion, but you can hold nurses accountable for their judgment. And dismissing a woman who is obviously in active labor is poor judgment. It's very dangerous. It's how babies are born in waiting rooms in cars and how women end up hemorrhaging because no one is noticing. For every nurse watching this video, treat laboring women like they matter, because they do. Stop acting like their pain doesn't matter. Stop being nonchalant because you're tired or overwhelmed or desensitized. And for every mother-to-be, speak up for yourself. Demand an assessment. Don't let anyone dismiss your pain or your urgency, because an incident like this could be fatal. I'll talk to you later, my loves. Bye.